Hello and welcome everybody. Thank you so much for joining us today. My name is Sarah, also known as Meg Davis. I'm based at the Global Health Center at the Graduate Institute in Geneva, Switzerland. And we're here today to talk about human rights, health, especially HIV and sexual and reproductive health in the digital age. We're talking about a booming industry. While many people have struggled in the COVID-19 pandemic, digital health has only grown. It's something like $29 billion invested in digital health last year alone, and much more expected for this year. And there's a lot of excitement about the possibilities of digital health to expand access to services for especially young people in low and middle income countries. But what's the reality? What are the risks and the opportunities for young people? And what should the UN and governments do? Should they actually do anything? Maybe they shouldn't do anything. That's one of the questions we're here to explore today with a very dynamic group of experts and advocates who I will be introducing to you shortly. You see them on your screen, and we'll tell you more about them in a moment. But first, I'd like to acknowledge the very hard work of my wonderful co-sponsors today. So in addition to the Graduate Institute, we have support from Fondation Botnar, Open Society University Network, and the global network of people living with HIV, KALIN in Kenya, Stop AIDS in the UK, and Y+ Global everywhere. Very pleased to have us all gathered today. We'd like to invite you all to introduce yourselves on the chat, say a bit about who you are and where you're joining from. We have French language interpretation available. If you click on the interpretation button, on peut entendre en français, much better French than mine. So please go ahead and access that if you wish. And we have 2 questions to get us started. So if I could ask my colleague to please launch the poll with the first question to all of you. How old are you? And feel free to tell us your honest age because we won't know who you are. So please share your age and then we'll share the results with you all. Our second question will be with us in a sec as soon as we share the results of the first question. But just so you can start, our second question is going to be to ask you whether the UN and governments should play a role in regulating digital platforms. So we have a very good spread of ages, as you can see the results. So thanks so much for sharing your ages, and good to see strong participation from some younger colleagues. Let's have the second question if we could. So should the UN and governments regulate digital spaces? Difficult question, and we only gave you 2 options. It's fine if you think it's none of the above or something else entirely, but we're curious to hear your thoughts about this. And please keep introducing yourselves in the chat. Thank you so much for sharing a bit about who you are and where you are joining us from. It's great to get a sense of the global reach of this conversation. Okay, so most people here think the UN and governments should do more to regulate digital spaces, but there's quite a few who think they should not. So that's very interesting. So we're looking forward to probing this a little bit more with all of your input. Before we do that though, we have, I'm very pleased to share a welcome message from Ambassador Stéphanie Sédou, who's the Ambassador for Global Health from France, who has some reflections. She was sorry not to join us today, but she can share a bit with us about France's approach to human rights, equity, gender, and HIV in the digital age. So let's enjoy this video. It's about 3.5 minutes long.
Bonjour à toutes et tous. Je suis très heureuse d'ouvrir ce webinaire qui abordera la question cruciale du respect des droits humains en lien avec le numérique. C'est un défi de taille que nous devons relever collectivement. Nous savons que les inégalités alimentent l'épidémie de sida et d'autres pandémies dans le monde. La crise de Covid-19 l'a malheureusement démontré. La France lutte contre les discriminations et pour le respect des minorités, l'égalité entre les femmes et les hommes, la protection des populations en situation de vulnérabilité et l'accès pour tous à des services de santé de qualité. Les politiques publiques ont la responsabilité, avec le soutien de tous les acteurs, de lever les freins économiques et sociaux qui rendent plus vulnérables les populations et les exposent davantage aux épidémies. Elles doivent aussi identifier les solutions pour réduire ces nombreuses inégalités. La couverture sanitaire universelle, la CSU, comprend une protection contre les risques financiers et donne accès à des services de santé essentiels de qualité et aux produits de santé. Elle doit rester l'objectif à atteindre. Il faut commencer par renforcer les systèmes de santé de manière durable et en premier lieu, soutenir les ressources humaines. Pour cela, il faut garantir, premièrement, un accès à des formations de qualité, deuxièmement, des conditions de travail sûres, troisièmement, une rémunération décente. Il faut également adopter une approche intégrée de la riposte au VIH dans les systèmes de santé. En outre, pour répondre aux enjeux sociétaux et aux défis sanitaires partout dans le monde, le numérique apparaît comme un outil pertinent pour améliorer la santé et le bien-être des populations. Le numérique peut aider à atteindre un plus grand nombre de personnes, y compris celles vivant dans des zones difficiles d'accès. Cela nécessite toutefois de définir un cadre juridique adéquat qui permette de partager les données pour les biens communs, tout en protégeant le respect de la vie privée et le consentement. Le 2 février dernier, dans le cadre de la présidence française du Conseil de l'Union européenne, les ministres de la Santé de l'Union européenne et la Commission européenne se sont réunis et ont adopté 16 principes européens pour l'éthique du numérique en santé sur 4 dimensions. Premièrement, inscrire le numérique en santé dans un cadre de valeurs humanistes. Deuxièmement, donner la main aux personnes sur le numérique et leurs données de santé. Troisièmement, développer un numérique en santé inclusif. Quatrièmement, mettre en œuvre un numérique en santé éco-responsable. Cette stratégie européenne pour le numérique en santé est une première. Elle apportera un socle pour protéger des dérives éventuelles, telles que le non-respect du droit à la vie privée, la collecte de données fausses ou biaisées, ou une utilisation non fondée sur le principe de bien commun, voire accroissant les inégalités. La question du consentement éclairé sur le partage des données, plus particulièrement des personnes vivantes avec le VIH, est centrale, tout comme la prise en compte des femmes et communautés marginalisées par le VIH dans la collecte et gestion des données. De même, il faut prévenir tout risque d'usage non contrôlé des données, par exemple à des fins commerciales. Le droit à la santé est un droit fondamental qu'il faut protéger et garantir, peu importe les origines, la religion, les opinions politiques, les conditions économiques et sociales ou le statut sérologique. Je vous souhaite des discussions riches et productives qui feront ressortir des solutions innovantes pour mettre fin à l'épidémie de sida d'ici 2030. Je vous remercie.
Very grateful to the ambassador and the French government for their support and for sharing those reflections and principles for our discussion. I just wanted to mention for those who are just joining us now, we have simultaneous interpretation in French. So please feel free to click on the interpretation button to access that. Join the conversation on Twitter using the hashtag Digital Health Rights, and share any questions you have in the Q&A box, as we will turn to questions in a little while. But first, very excited also to welcome Dr. Tlaleng Mofokeng, the UN Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Dr. Tlaleng is a commissioner at the Commission for Gender Equality in South Africa, member of the boards of the Global Advisory Board for Sexual Health and Wellbeing, Accountability International, and the Soul City Institute, and very dynamic spokesperson on Twitter as well. So very pleased to have you here, Dr. T, and look forward to hearing your thoughts. Thank you.
Thanks so much, Meg. Good afternoon to everyone. And thank you always for sharing these invitations with me. As you know, that this topic of digital health and innovation and intervention in the field of healthcare is something I'm particularly passionate about. And I think that has to do a little bit with my own advocacy and activist journey, and started off as a young medical student, a young intern at the time, and having to connect with my fellow peers who were patients seeking access to information mainly, and how I've also successfully used radio, television, and print, and more recently digital tools such as social media to actually give information to people and link them to services. So this is something that really is important. And even in my Human Rights Council report and the General Assembly report of last year, speaking to member states about the importance and the powerful tool that digital innovation and interventions can be in healthcare. And whether you're talking in the context of COVID or you're talking in the context of HIV prevention, management, and care, it really is important that slogan of the UN that we know so much, that the Sustainable Development Goals and all the accelerated efforts truly leave no one behind. I think that slogan rings hollow if we actually don't commit to understanding the multiple dimensions, the multiple locations that people find themselves in. So in the global HIV response, we've all known long that addressing human rights is very important. The issue of criminalization continue to worry me as well. The issues of marginalization also continues to be problematic, because we know people who are marginalized, by various things such as race or ethnicity or class or migration status. Even we know that they are usually cut out of care and services and accessing information as well. So it's very important that we mobilize communities to lead to service delivery and advocate for their rights in how these solutions can be progressive for them in their particular context, because we know that the solutions cannot be just a blanket approach. And so I think an important question to ask is, what does this look like? What does this process look like? And how do we make this progress? And I think for me, it's very simple. We need an intersectional analysis of the right to health, but specifically digital health. We must take into account gender inequalities, the socioeconomic inequalities, and of course, continuation of the marginalization through legal means or otherwise. Among countries, of course, we know many are still dealing with the legacy of colonialism. Many countries in the so-called global South are still grappling with the issues of inequalities, right, caused by many long-standing forms of discrimination. And so I think digital solutions, digital innovation in the field of health is really transformative and offers us the opportunity to leap forward in getting health services and information to those who need it most. And I think it's important at this point to also underscore the fact that digital transformation, digital health and tools are part and should be subject to human rights standards and principles, and that there is a danger, right, as we move forward with the fourth industrial revolution in some countries, as we often hear, as we move forward with the implementation of digital tools and in innovation, that we know that most people are already marginalized. So we don't want to then, in the implementation of even amazing programs that are designed well, that we will continue to further leave people behind if we don't think through and address those inequalities that exist. And of course, we know that the right to the highest attainable standard of physical and mental health should be attainable to all without discrimination. And I do believe, even with the challenges of legislation, with the challenges of monitoring of these tools, that for me, it still remains a really powerful, positive tool. When it comes to the global digital divide, I think we know that many are multiple, especially when it comes to health status. And so people either already living with HIV are most vulnerable to the disease. We know that there are people, for example, through their occupation, that their risks of acquiring HIV, for example, may be higher than the general population, such as sex workers. So it's important to think about intentionally about upskilling and giving some of those marginalized populations, such as women, especially trans women who are sex workers, who may lack the basic sort of access tools, the gadgets themselves, but also some of the skills and how to actually be online in a safe way. But also it's important to also remember the legislative or the legal framework, right? That in some countries, a lot of our peers, our folks couldn't even be on this call because of the surveillance that happens to many human rights defenders, regardless of what you are dealing with. And we know that health status is one of those issues that continue to be used by many states to harass people. I also think it's important at this stage to talk about the gender gap due to lack of access to education. Girls are still being burdened, right, with household chores, that even in those communities where there is progress, it's the boy child who's most likely going to end up with a gadget, and where there is some sort of equity in terms of access to gadgets, the cost of data is still very much a hindrance, but also women globally are less likely than men to download software or apps or engage online, just simply because they also don't have the resources to do so. It's also important, of course, to also interrogate the idea that the success of digital innovations in men are not necessarily because men show up more, right? Or they take up these innovations more than women. I think it's a more of a structural issue that many women actually still have to, make their money, spread across families. They're taking care of extended families. So women are still the least paid in the workspace. And so I think the digital health innovations and innovations have a particular role to play in gender equity and making a bigger a case for why there should be equity in all spaces of our lives. And I just want to say also, I mean, the big issue for me is still criminalization, stigma, and discrimination. And this, of course, again, impacts communities that are least empowered economically. They are least empowered to also seek justice when things go wrong. And so we need to think about what does it mean for people living with HIV, those who have been established as populations at risk. What does it mean for them to live in these criminalized, highly stigmatized spaces? And what's our responsibility as people who are, innovating in the area of health? And we won't have enough time to go into this now, but I think it's important to talk about what Nick Couldry and Alexis Mejias call the data colonialism, right? This idea that because of the stringent and protective laws in the global north, you have corporations then going into the low middle income countries to get data, and something that we commonly refer to as mining of data. And that very much mimics the colonial tendencies, right, where mineral resources and human resources continue to be extracted from the global south. And so we have to pay attention to the politics around data and data colonialism, and what I often refer to as mining of data. And in closing, Meg, I just want to say that the right of everyone to the enjoyment of the highest attainable standard of physical and mental health is related to other multiple human rights which are indivisible. And this is why these discussions around digital health innovation are human rights issues. And this is why we have to get everyone on board, whether it's the United Nations, the different programmatic areas, as well as communities on the ground and member states. I think the right to dignity is important. We have to protect the right to information as well as privacy, freedom and security of the person, the right to equality and non-discrimination, and the right to bodily autonomy. Digital innovation, in my point of view, is still a powerful tool to protect these rights, given that, and it requires us to make sure that corporations actually then sign up and understand their role in terms of human rights protections. And I know that there'll be time later for Q&A, so I'll stop here and we'll just then, give a bit more of my thoughts at that time. Thank you.
Thank you so much for those powerful and inspiring thoughts, Dr. Slaling, and for really giving us a clear framing in terms of the right to health and other related rights, as well as you're thinking about intersectionality, data colonialism, and the diverse forms of inequality that shape both the tools themselves and how people access them and use them in diverse settings. So with that, we're going to have a short presentation from the Digital Health and Rights Project before we open up for a broader discussion to give ourselves some empirical data to kind of chew over in this conversation. And so briefly, I just wanted to introduce you to the Digital Health and Rights Participatory Action Research Project. And my colleague Tara Imalingat is going to present some of the observations we have. It's too early to call them findings, really, because we're still data gathering. But some of the things that we've been observing in our field research in Kenya, the first country in our multi-country study. And to give you the background, this is a project that brings together all the partners that you see here. We're very honored to have UNDP chairing our advisory committee. Dr. Slaling is one of the esteemed members. I see others are actually in the audience right now, so that's great. And this really arose as an impetus from GNP+, Kaylin, and Stop AIDS from their positions as delegates on the board of the Global Fund, where even pre-COVID, they were starting to see this real boom in digital health, these new partnerships being formed by global health funders with the private sector. And it just raised a lot of questions about what the realities are for their constituencies and communities in low and middle income countries, in context especially of widespread discrimination and criminalization, gender inequality, this sort of widespread challenge we face with unequal knowledge, so that some people are producing knowledge and other people have knowledge produced about them, and how little power the people who are producing the data, especially young people, have over who gathers the data, where it goes, and how it's used. Exactly those issues of data colonialism that Dr. Thalling highlighted. And so they really were interested to hear what the reality is for communities. And so we developed this study in collaboration with social scientists, human rights lawyers, and advocates and communities, and decided to focus first in Kenya, Ghana, and Vietnam. And then a second phase of the study, which is just now beginning, is in Bangladesh and Colombia, with support from our 2 donors mentioned here. Our research methods, we're using participatory action research, which is really widespread, I think, now in many health facilities and even at national levels. We may be doing one of the first global health participatory action research studies, in which we work together at every stage to develop the tools, the protocols, the instruments, gather the data, and reflect on it for action. We have a transnational community of young researchers, many under 30, certainly some of us much over 30, but also a fairly diverse group, who are working together, meeting weekly, providing support to one another, and even traveling to each other's countries to help out when we can. We're in the midst of doing a scoping review on digital health rights to understand what the basis is for this in peer-reviewed literature and the empirical basis, as well as other thinking that's been done to define what human rights are in digital health. And then we're doing all these other things, social science research in each of our countries where we're focusing, doing comparative law and policy review. So we have a paper which my colleague Tui will share in the chat, which compares laws and policies in Ghana, Kenya, and Vietnam on digital health. Tara and other colleagues conducted digital ethnography, participant observation in digital spaces to understand how young people use Facebook and Twitter and TikTok and Instagram and many other tools to get health information and services. And then in Kenya, Kaylin and Tara in particular led focus groups in Nairobi and Kisumu with 74 young people, including young people living with HIV, key populations, young women and others, young activists, different backgrounds, and key informant interviews with diverse experts across the country. We're now just starting on the data analysis, and then there'll be a validation meeting, which Tara and colleagues will organize in Kenya to share findings and recommendations for input by everyone who participated in the study. So this is our process. With that, I'm going to turn over to my colleague, Tara, who will share with you some of the initial observations we have from the research. Tara? Oh, sorry, Tara, I was going to introduce you. I didn't even do that. So Tara is a lawyer and health and human rights advocate at Kaylin in Kenya. She holds an LLB and a postgraduate diploma in healthcare ethics and law from the University of Manchester. Over to you.
All right, thank you so much, Meg. Yeah, so I think Meg has given you a breakdown of what we are doing under this Digital Health and Rights Project. So here in Kenya, I can definitely say that the respondents do feel that having a mobile phone and having internet access is actually becoming a basic need. And a lot of them use their mobile phones to do practically everything, including earn a living. So as you can see in this slide, some of the statements they made really speak to the importance of mobile phones today. So we have someone saying that I am so addicted to my phone, others saying that my phone is like my personal doctor, or my phone is like my baby. So these are quite exaggerated statements, but they really speak to how young people are using and feel about their mobile phones. I think we really have investigated how young people are using technology to access this health information or services. And what we found was that many young people are actually seeking health information online, and they prefer it over seeking health information from health facilities, because in their opinion, they are able to avoid the risk of stigma and discrimination that many of them experience when they physically go to these health facilities. And this is particularly true for key populations who are highly stigmatized and discriminated against here in Kenya. So what we found is that many young people are using Google more than anything else to access health information. But what was interesting as we conducted the digital health ethnography was that many are now relying on social media platforms like Facebook and TikTok and Twitter to access this information. And I think what we're seeing is this emerging trend with social entrepreneurs who are using social media to share sexual and reproductive health information with young people. And one platform that we were able to find, and I'm sure you can see a small picture of it on the slide, is Love Matters Kenya, which is a health and wellness website which shares information on love, sex, and relationships for young adults between the ages of 10 and 35. It actually has a Facebook following of over 1.7 million people, which is quite impressive. And what they do is they summarize content using contextually relevant images and infographics to ensure that young people can easily engage with the information on the site. And what's really nice about Love Matters is that they've been able to create a community and a safe environment for people to engage with this content and to freely express themselves. One of the most interesting things we found was that a lot of men are actually engaging with this platform, which I think is indicative of a demand for their inclusion within sexual and reproductive health spaces, which for a long time has been dominated by women. Luckily, the founder of Love Matters Kenya was one of our key informant interviewees, and she told us how they use the data they collect from Facebook and different comments to draw and tailor the content that they put out. So they're very intentional about ensuring that all the posts and everything they share is relevant and is in demand. Another platform which we came across was a blog called The Spread Pod. It is a platform that's being run by a certified sex educator. Her name is Kaz. She's non-binary and is sex positive. And what she's trying to do is she's trying to empower young people on sexual health and rights and sexuality. So I think what she's trying to do is to fill a gap in knowledge on sex education, which many young people I know here in Kenya are not taught, at home. So what happens is this leads to unsafe sexual practices, an increase in HIV infections and other sexually transmitted infections. So like Love Matters, the Spread Pod has been able to create a safe space for young people, women, and queer people to learn more about themselves and to learn about safe sex practices. So I think what we're seeing in Kenya is that there's a lot going on social media. Now social media is playing such an important role when it comes to information dissemination. And something we noted was the lack of regulation of this social media is allowing a lot more innovation when it comes to sexual health education for a lot of these social entrepreneurs. And then on the other side, though, we did hear a lot of concern about censorship, particularly on platforms like Facebook, where someone gave an example of where they tried to post a video of them showing people how to use a condom, and that was taken out. So in a way, censorship to them is preventing them from sharing this quote unquote explicit information that we believe the audiences really need to see. So I think we're definitely seeing a lot of young people using social media to access health information, but of course they do express their concerns with misinformation and the privacy of their data. But many of them acknowledge that, social media is not 100% going to protect the information. And one person actually said that the best way to protect yourself from social media is not to be on social media at all. So that really tells you that they're cognizant of the fact that, you wouldn't be fully protected online, but that doesn't stop them from, taking advantage of the different platforms and information available to them. We also were able to find mobile applications. I think one particularly called Auntie Jane, which is an online platform where anyone seeking information on sexual and reproductive health basically calls a hotline, and you can talk to a counselor who then offers you health advice and may even refer you to a health facility. So we have been able to find this amazing app, and it's been talked about across all the different focus group discussions. So definitely we're seeing there's a demand for mobile applications around health in Kenya, and they are being used, although they're not being talked about as much as we'd like. So I think although we are seeing a lot of digital health applications being used, there's still a large digital divide. And in Kenya, actually, we had 43.5% of the people in the country in 2019 owned a mobile phone. And a majority of these people are actually using the internet, their phones to access the internet. But I think because of the high cost of data and the lack of internet, a lot of groups are being left out of the digital age, including young people and the rural poor who actually just can't afford internet or data to connect to the internet. So in Kisumu, for example, which is one of the counties we carried out our focus group discussions in, many young people are just relying on toll-free lines to access health information and health advice, or to report sexual and gender-based violence incidences. So they were really utilizing offline initiatives rather than online ones because they just couldn't afford it. Another challenge that a lot of them raised was the issue of people with disabilities being left out of the digital health revolution. And they did state that it looks like a lot of these applications are not being developed to accommodate for their needs. So they did really raise those concerns. And finally, they did talk about the differences in access between men and women. Where women, of course, in Kenya have less access to these digital technologies. And I believe Dr. Talaeng actually mentioned quite a few of them. And I think, she mentioned the fact that they have access to less training, and as a result, they're not able to participate in the tech sector as much as their male counterparts. So I think that's what makes platforms like Love Matters and the Spreadpot so amazing, is that they are finding innovative ways of sharing information with everyone from everywhere and making others feel as included in the digital revolution as possible. So I don't think it's possible to talk about human rights in the digital age without talking about the risks that these digital health applications bring. So these are just some of the different risks that our participants really talked about quite a lot and felt very strongly about. So I'll just briefly talk about each and every one of them. The first being misinformation and censorship, which I believe I mentioned above. And then the next one is the inaccurate and incorrect self-diagnosis. So in this case, we have many young people who are going online, typing in their symptoms, and then self-diagnosing themselves. And in some cases, we actually heard of one gentleman who actually went ahead and purchased medications and then later found out that those were actually the wrong medications for the wrong issue because he had self-diagnosed himself. And so that has the effect of causing more harm than good if that continues to happen. And then we have the non-consensual sharing of information, where personal data is being shared between companies or governments. And this is leaving young people vulnerable to the exploitative uses of their information. For example, across all the different focus group discussions, the participants did mention how in Kenya they did receive text messages telling them they had been registered into different political parties in the country, but that wasn't the case. So that's an example of an apparent violation of their privacy here in Kenya. And speaking of privacy, a lot of them really wanted us to understand that exposure online leads to stigma and discrimination offline, particularly for vulnerable communities, so people living with HIV and other key populations, sex workers. And they did talk about a lot of the harassment that they got online. And we were also able to document a lot of hurtful speech that they are receiving as a result of, their data being shared without their knowledge, or because their privacy has been breached in one way or another. And finally, I think sexual harassment really, that was a tough conversation to have. But one key example was that we were seeing cases. One lady talked about there being cases of gender-based violence because men were actually using their phones to track other women's phones and follow them. So that was a very serious risk that we were able to document, and something that we really need to start talking about, the fact that a lot of human rights violations may be caused and created by these different innovations in digital technologies and digital health. So some of the recommendations that we have, and some that the participants felt really strongly about, include some recommendations to the government. And this includes creating an enabling legal and policy environment for data protection and digital health. So that just means that we want the government to ensure that they are passing laws and policies that are rights-based, and that they are exercising their mandate in a way that ensures that these laws are also implemented in a rights-based manner. And then, of course, we want the government to engage young people more and more, ensure that they're part of discussions being held when different laws are being drafted. For example, here in Kenya, we have the e-health bill, which is still in parliament, but we do not know if young people have been involved, and if a rights-based approach is being implemented and is being, drafted within this e-health bill. And finally, we want the government to engage private sector so that they can enable young people to equally participate in the digital age by lowering the cost of data and internet, and just allowing people from hard to reach areas to access these digital health technologies as well. And then we also have some recommendations for the UN agencies and the international community at large. And we'd like them to continue to promote rights-based approaches to the use of digital technologies, and also to support civil society where they can, whether that's through donating funds or working with the government. We also want them to document good practices like the ones I mentioned, Love Matters and the Spreadboard, where they're using digital platforms to promote sexual and reproductive health information or HIV information, just to show others that these are innovative ways of ensuring that everyone has access to health information. And we also want them to work with governments to strengthen digital governance and ensure that health is integrated into digital governance. And that's also speaks to health data governance, which is so important right now because a lot of the digital technologies are heavily data-driven. And finally, to civil society and the community, we would like them to provide more digital literacy training and to mobilize young people to learn more about the digital age, how to use devices, and to participate in public spaces, especially where decisions about the development of digital technologies are being made. So I think I'll end there and pass it over to Meg to conclude the presentation. Thank you.
Thanks. Thank you so much, Tara. Very rich findings and fantastic work in Kenya. Just to wrap this phase of the discussion up, we will be completing the data gathering in Kenya, Ghana, and Vietnam in the next few weeks. And then we do data analysis where we code everything and we analyze the results in depth. That will be followed by national validation meetings in each country with all the people who participated in the study to discuss the findings and the recommendations and how to take them forward into action. And meanwhile, our colleagues in Bangladesh and Colombia, some of whom are on this call, are also getting started with the next phase of the study in those countries as well. So thank you very much. With that, I would like to stop sharing my screen and begin to open up the discussion to our esteemed panelists. So really honored and pleased to be joined today by, in addition to Dr. Tlaling, we also have with us Dr. Mandeep Dhaliwal. And thank you so much to UNDP for co-sponsoring this discussion, as well as for their work putting out some groundbreaking guidelines on health, HIV, human rights in digital technologies. Mandeep is the director of UNDP's HIV Health and Development Group in the Bureau of Policy and Program Support. She is a veteran human rights advocate, starting with co-founding the Lawyers Collective, HIV/AIDS unit in India, and then moving into the UN system, where she helped to architect the Global Commission on HIV and the Law, which is one of the great models of this kind of consultation and mobilization globally. As well as, we're also joined by Joyce Uma. Very excited to have you with us, Joyce. And Joyce is a youth activist from Kenya, and here on behalf of Y+ Global, where she leads work on innovation, influence, and engagement at the global network of young people living with HIV. Joyce is also a leader in the Global Fund space. She's on the communities delegation and engages with the country coordinating mechanism in Kenya. So welcome also, Joyce. So I just wanted to open up the discussion to all three of our esteemed panelists, and just to ask if you had anything from Tara's presentation that struck you that you really wanted to react to right off the bat. She spoke both about the empowerment potential and the innovation, as well as some of the risks. So just throwing this one out to the floor to anyone who would like to immediately comment on it.
Thanks, Megan. Thanks for the lovely introduction. And it's a pleasure to be here with all of you. And it was great to hear the presentation of the results, because I think we need as much empirical data as possible to really drive our discussions on this. I just want to pick up on 2 points. You know, from our perspective, what we see, and to some extent facilitated by COVID, is this incredible acceleration of the use of digital tools, and critical for, you know, increasing access to services, reaching the hard to reach, addressing structural barriers, connecting communities. All of that is fantastic. But at the same time, we're not seeing sufficient attention to what the risks are and how do we mitigate those risks. And you know, this fourth industrial revolution that Dr. T talked about, I mean, that was racing ahead in the area of digital health well before COVID. So I think we've got to play catch up now. So I think that's one thing. I think there's an urgency around making sure that we get the human rights and ethics right around this. So that's one of my reflections. The other reflection really is, you know, we've heard it through all the presentations now, is that this is not a level playing field, right? We're talking about a digital divide where women, marginalized and criminalized populations are left behind and are at disproportionately higher risk of the risks of some of these digital technologies, and in addition have less access. So I think in the field of HIV, that's something that we really need to bear in mind. And the last point, I think, which we really need to reflect on more, is this connection between data and digital. We spend a lot of time kind of fetishizing digital tools and digital, all that is digital and innovation. But the real crux of the issue is the data that's being harvested and that's being collected. And who does that data belong to? And are those people at the table when we are talking about policies, regulations, and legal frameworks and rights-based approaches? So I think there needs, digital and data in my mind really go together, and we need to be connecting those dots much more. But I'll come in more later on. But wonderful presentations, and I'll stop here. Thanks.
Thanks so much, Mandeep. I think you've really hit the nail on the head in terms of some of the issues and challenges ahead. I just wanted to see if Tlaling or Joyce, if you had any reflections on this.
Yeah, so I think one of the things I've been advocating for is it's not enough just to give information. You know, when you start talking about violence, you know, that women face online, that children face online, adolescents, right? Gender non-conforming people. I think we have to build in some way, some referral pathway, or at least a resource to say, you know, if you experience this kind of issue online, you know, it does fit the definitions of harassment and violence, because many people then actually go offline not knowing how to process what has happened online. And I think is to think more deeply about that, because we want to assist people with tools, right, for physical health, but those tools may enable mental health abuses and those and the like. So I think it's important to think about how do we, and this is why these tools have to be connected to the community, right? Because the community knows what's priority for them. The community knows what they need first, and the community will know the kind of resources that must then be inbuilt into some of these apps and digital solutions. Thank you.
Great, thanks so much. Beautifully said about the community engagement and role and the referral pathways for sure. I think we're having a lot of people who get driven off of these spaces. And I think that then creates a barrier to their right to health, right? If they feel that the online spaces are not safe for them, then they're not going to be able to use them in the most effective way. Joyce, any thoughts from you?
Yes, thank you very much, Megan. Thank you, Tara, for that amazing presentation, just showing how the situation is in my country, Kenya. It sort of somehow just brings to light a lot of the things that I really wanted to mention when I was invited to this session. So currently on my phone, I have around 16 apps. And among the 16 apps, I have only opened 9 in the past 3 days. But all these 16 apps have my information. And when I received this invitation to speak during this session, I wondered, what have I been giving out? And what do they use my data for? And how safe am I? So in this session, I am representing Y+ Global, but in another session, I probably came out as a young woman living openly with HIV, but it's probably because I felt safe at that time. But as Tara has mentioned, at some point we disclose certain things online, and then when you experience the stigma, you experience the discrimination offline. So this becomes something that has a multiple effect, especially on adolescents and young people. But I'm really excited that also Tara's presentation highlighted how important these digital health technologies are. They have given us easy access to services as young people. They have also enabled us to reach populations that are vulnerable and populations that have been traditionally characterized as hard-to-reach populations, such as the young men who do not seek health services physically at the facilities. But here we have these digital technologies bringing services, bringing commodities to our doorsteps, and that's amazing, and that is what we all want. And this also promotes new interventions such as self-care, and also promotes our autonomy as young people and us owning our own health. So this is definitely great. But also, as Tara's presentation highlighted, that it is not all that glitters that is gold. We have our own fears. And as a network that works with adolescents and young people living with HIV, as a network that works with young key populations and vulnerable populations, we are worried about having the data of young people being out there, but not knowing how or who is using this data and for what purpose. And just now I learned that some of our data could actually be traded out as commodities. So this is a very eye-opening conversation, and yeah, I'm really excited and really looking forward into how can we as young people feed into this conversation. One thing that has also come to light is that we are not even sure at this point if we have any sort of like regulations. Do we have any digital health rights? What can we do as young people to ensure our safety online and in our lives outside our chosen social media platforms? Yeah, thank you.
Thank you, Joyce. Really powerful reflections, and thank you for sharing your perspectives living with HIV and as a young woman in Kenya. Really helpful for us to hear that angle. And you know, the question of what our rights are is a really interesting question that Tara really helped to probe a little bit in Kenya, where we learned a lot about the Data Protection Act in Kenya. And Tara started doing presentations for young people where after we finished the focus group discussion, we would share with them a bit of what we had learned about the Data Protection Act. And most of the young people that we spoke with really had not heard of it before, didn't know what their rights were, didn't have a sense of where their data was going, or that it was producing profit for people in my own home country in the US. right? And so I think that that lack of awareness is something that we need to really address. And we spent some time thinking about that. But maybe just to take a step back, the big picture, and this is a question for Mandeep. We now have a new global AIDS strategy and a 2021 political declaration, and what kinds of opportunities and protections are included in commitments in those new strategies?
Thanks very much, Meg. And, I think just taking a step back, I mean, even before the political declaration and the global AIDS strategy and the global fund strategy, governments have obligations under international treaties to promote, protect, and fulfill human rights, including the rights to health, privacy, non-discrimination, to enjoy the benefits of scientific progress and its application. So these remain relevant in the HIV and digital space. The political declaration, the global AIDS strategy, all talk about ensuring that the use of digital health technologies are consistent with human rights obligations. And that if we want investments in science and technology, it has to work for the people most in need, the people living with, at risk of, affected by HIV, young people, adolescents, women and girls, criminalized populations. So I think the trick is, and this is something that is, it's great to have these obligations on paper. Many UN documents are filled with this language. It's how do you make this real for national policy, regulation, law, and how do you make it real for the people who, the people who own the data, the people who are using the digital technologies. And so that's the real role, which I think is critical for governments. And I think as the UN, the Secretary General in his Our Common Agenda report calls for updating the application of human rights frameworks and standards to prevent harm in digital and technological spaces. He also calls for universal access to the internet as a human right, closing the digital divide, and regulation and management of our digital commons as a global public good. I think it's imperative for the UN to play its role in convening the full range of stakeholders that are involved, creating these enabling norms and frameworks, but also doing this in a way that, and you're not going to be surprised to hear me say this, that creates a level playing field for communities, criminalized, vulnerable, marginalized populations to have a seat at the table and to be able to freely express their voice in such convenings. And I think that for me is really critical. And I think it's urgent. The time was yesterday, as you said, and many speakers have said, this is moving ahead at a digital pace, and we're still moving at an analog pace when it comes to the human rights discussion. So I'm really excited about the study and to be part of this, because I think we really have to get moving on the application of human rights and ethical principles in a way that makes a difference on the ground to the most vulnerable and marginalized communities. So I'll stop there. Thanks.
Thanks, Mandeep. It's very compelling. I just want to ask a follow-up question, and maybe to you and to Joyce, and then I promise we'll turn to the questions coming in from our participants, and please keep those coming. But, so for instance, just to take Kenya as an example, I mean, we found in our interviews that there is an e-health bill being drafted in Kenya right now, with very active participation from private sector actors who are contributing to the drafting, but young people didn't know about it. And our UN partners in health were not engaged so much. And so just curious, in a situation like that, maybe I'll ask first you what you think the UN partners could do would be appropriate, and also Joyce, how youth could potentially get engaged.
Yeah, I think we still suffer from a problem, even though we have the Agenda 2030 and the SDGs, which are all about connecting the dots. But I think sometimes these conversations are very siloed at the country level. So I think, it's important for UN colleagues to be really looking at health in a much more multi-sectoral, intersectoral way, and looking at the intersectionality issues. Engaging with communities is critical. I mean, I think the UN AIDS and joint teams, where all the UN agencies who are co-sponsors sit, should be tracking these kinds of issues and should be facilitating these kinds of conversations. And I think, as the chair of the Project Advisory Committee on this initiative, one of the things that we want to help with, based on some of the consultation work that we did for the Commission, is to help take this kind of consultation process and apply it to the issue of digital health and rights, and make sure that we cover data in that, because that's how we're going to connect the dots across multiple sectors, and make sure that young people and other vulnerable, marginalized, criminalized communities are at the table. So I'll stop there.
Great, thanks Mandeep. Joyce?
Thank you, Meg. So it's quite interesting that there is an e-health bill that is happening, that is being developed in my country. And I am a very active youth activist, but I have no idea what this is, what it entails. But somehow it's supposed to be addressing some of the needs that I have, because as young people, we are the greatest population that is actually using these technologies, but nobody saw it fit to work with us when developing this. So the situation in my country currently is that young people are viewed as beneficiaries and not as equal stakeholders. We do not have a level playground. So we come in either to validate, or we come in either to rubber stamp. And this has been happening for a very long time. But to answer your question, I didn't know about it, but it's never really too late to look at this from like a global picture, of course, and even at the country level. Currently, most young people do not know what digital health is. They don't know what it means to click a button and give consent to specific data to be used elsewhere, because most of those terms and conditions are either not present, or they're written in very many words that are not youth friendly. So you will give away your consent, but you will never really know what you're giving up. So one thing I would suggest is that as young people, we need to be supported to understand what digital literacy is, so that we know what we are advocating for in all our diversity. Because yes, we know, and we've mentioned that we cannot advocate for something that we ourselves do not understand. And the other thing is, we need to know what are our digital rights, and if this e-health bill will contain it or not, then we need to be part at the forefront of spearheading these discussions. And that means we need to continue pushing for online access for all young people, making this the issue of data. First of all, I feel like we have been talking a lot about the new digital era, but we have left behind a whole population in the rural areas, a whole population of women. And this is continuously deepening the inequalities that we've been experiencing. And it's now slowly becoming gendered digital divide. So I'm really happy to hear that internet can actually be considered a basic need. And so if that is something that an advocacy ask and an advocacy task that as young people we can take up. But the one thing that we from our end as Y+ Global and as a youth activists, we can commit to do is to support the partners to ensure that young people in all their diversity, especially the vulnerable populations, have access to information about digital health literacy in spaces that are youth friendly and in spaces that are youth accessible, so that we do not leave others behind, where we move forward with new innovations and with new skills that will really benefit us. Yep, thank you.
Thank you, Joyce. And that really echoes, I think, what we saw, in terms of the real desire to have this knowledge by young people, and then to be able to have a voice in the process and not just be rubber stamping. So I wanted to pass the next question to Dr. Thalang. So we have two questions from the chat, and I apologize. I did promise our interpreter a break. So our interpreter will take a quick break for a couple of minutes, but we'll be back to join us just for the last 10 minutes of this discussion. But just this next question, two questions, one from Anna and one from Dijen in the Q&A about risks and how we could begin to mitigate the risks and make online spaces safer. And I think the challenge is, how do we do that without censoring? So I just wonder, Thalang, if you could sort of talk to this question of how to balance the need for better governance and safety, and also the need for freedom of expression online.
And I think, Meg, we just heard from Joyce, why I think part of the answer is that we won't get to those solutions that are comprehensive if people who are affected most by these projects, by these interventions, are not on the table. And I think it's important, especially when we're thinking about the structure of the health system itself, right? to keep demanding that communities must be at the decision-making spaces, because it's also one thing to just consult communities outside of making decisions. It's important that they are at the decision-making spaces, that young people are represented there, and not just for the sake of tokenism to say, well, we have young people here, but that they are also empowered and given the authority to make and effect these changes that we need. I think it's also an important thing to talk about, the presence of the health boards, right? The governing boards, and this may be different in different countries. But in South Africa, you've got a community clinic, and that clinic is governed also by a board that's representatives of the community, right? You have that at district level, and it should be replicated in all the levels. So in a clinical setting, I think young people and people who are mostly affected by this, especially people with HIV, must be in those decision-making spaces in clinical care at the level of health systems, right? In terms of politically as well, because we know that research may show us particular trends, but the health system is not agile enough, right, to update protocols and to take up the research and turn it into accessible services, especially when there's either political interference or there's no political will. And the issue of corruption, Meg, in the health sector is something that we can't underplay. And I don't think we speak enough about how much that actually hampers all of our efforts to try and be comprehensive, but also ensure that, people participate. So I think for me, it's also about, people transparency. I think when we don't trust that elected leaders are making the decisions that are best for us, even when a program is well funded and it has all the different projections and indicators, you will find that it doesn't quite take up. In South Africa, we still don't have the desired outcomes, despite the millions of US dollars spent, right, around prevention, especially adolescent girls and women. So there's a need there to talk about the social power and the structure of society, because digital solutions are happening in that context of patriarchal control, of patriarchal violence, of political leadership that's not accountable to anyone. There's no transparency in how policy and allocation, right, in terms of funding and spending in the health sector is concerned. And so I appeal all the time, we mustn't look at young people as only recipients, right, of care or recipients of aid. They themselves are leaders in their own right. And we need to break that cycle of only engaging young people as a focus group, but not as leaders in their own rights. And I think that's what's really important here. And I hope, it's not a full-on answer, but I think these are some of the different things I think impact, the ability to be truly successful and comprehensive.
Thank you for answering a technical question with a political answer. I think that's brilliant. Sort of thinking about how we begin to shift power versus having to balance abstract concepts, I think is brilliant. Tara, I wanted to bounce the next question to you. We had a question from an anonymous attendee about how to address barriers to access to justice, and especially when we think about these issues that Taling has highlighted of violence and accountability. Do you have any thoughts about access to justice? Thanks.
Yeah, thanks, Meg. So I think it's safe to say that we are developing technologies at such a fast pace that we're trying to play catch up with our laws, and we don't have a lot of laws to govern these digital health technologies. So there've been persisting human rights violations going on, even as this digital revolution is coming. And I think the courts will really play such an important role as we continue to see this digital transition, because they're in a position to ensure that the private sector and the government are adhering to data protection laws and laws that are rights-based. But I think we really need the UN's convening ability to ensure that our governments are actually in a position to ensure that rights-based policies and laws are being implemented, are being developed. So I think it starts with the UN and different international communities and the government convening and coming together and having, discussions about how to ensure we have laws that are rights-based. And then on the other side, we have the judiciary that needs to be empowered with knowledge on digital health, or not with knowledge on digital rights, to ensure that they're able to ensure the enforcement of these laws, and that private sector and government don't abuse our health data or our personal data like they have over time. And for example, in Kenya, we've seen that the courts have been really successful with our digital identity system called Huduma Number, where the courts did halt the continued rollout of this digital ID system because there was no data impact assessment being carried out to ensure that our data is safe and protected. So already we're seeing the role of the courts and the importance of them being empowered with knowledge on digital rights. So I think with time, we'll get to see how different government actors get involved. But at the moment, I think most of us are looking at the courts to get us started on this. But yeah.
Great, thank you very much. I wanted to move on because we have so many great questions coming in, and I don't know if we'll get to all of them, but you can also join the Twitter chat and we can continue the conversation with our panelists there. We have 8 more minutes left to go here. But I just wanted to turn to Aditya's question from Input, the International Network of People Who Use Drugs. And Aditya is asking about the issue of hostile digital spaces and the fact that there are spaces where IT laws are being used to target criminalized and marginalized groups. We're seeing also people being attacked and charged in terms of their posts online that relate to sexual and reproductive health and other related topics. And I just wanted to see if Mandeep or Tlaling, if you wanted to speak to this issue of hostile digital spaces for key population.
Let me come in really quickly here. I also wanted to pick up on the mental health questions that are in the chat. And I think that, we really do need to connect the dots on digital and mental health. It's super important for people with mental health issues, but also with the mental health impact of the use of digital technologies. So I think both of those dimensions need to be addressed in the human rights and digital health conversation. On the criminalized, I think, cyberbullying and, surveillance through social media of criminalized populations and civil society more broadly, we've seen governments use data, that they mine on Twitter and other places to target civil society groups. We see that as one of the tactics to shrink civic space. So I think there needs to be a lot more attention to this issue. And yes, it's wonderful that, we can use these platforms to increase access to services. And, UNDP during COVID, there was a lot of work we did about, creating access safely for key populations, criminalized populations to access services, and that was great. But we do need to pay attention to the protection of data, safety, especially of criminalized populations. And that will mean, I think, looking at the broader data protection rules and guidance that countries are developing. I suspect that they're also playing a little bit of catch up in that area, so there might be an opportunity to influence that. I'll stop there. Thanks.
Great, thank you. Tlaling?
Yeah, Meg, so I think it's important, because I first and foremost look at these issues as issues of human rights. And so people who do this work, I view them as human rights defenders because of that context that I spoke about previously, the political context, the global regressions on autonomy, on women's rights, LGBTQI plus rights as well. So we're not just doing this work in a sterile environment. The context is such that then the backlash, is often on the individual and not necessarily on the institution. So you have a lot of young people who come into the space of advocacy and peer educating, especially around HIV, either because they have a personal story or because they live in the community where, there may be high, prevalence of HIV. is that they are not always, and not many of them are given the actual tools of advocacy, right? It's assumed that the passion and the fire is enough. But I think we need to be intentional about not just looking at the people who are going to be benefiting from the technology, but think about the people who are at the back end of supporting those projects and that technology. And I speak as someone who's constantly under attack online, offline, simply because of the work I do on protecting and defending autonomy, right? And I say autonomy because it is more than about abortion access. It really is about the attacks right now globally are really about just anyone to have an autonomous, free life. And I think that's very important because young people come into this space when they themselves may be adolescents, they may be just transitioning into adulthood, and they have other areas of concern that also need support. And that's why my focus also is in the way that health funding and financing for programs in healthcare are structured. Because no one wants to support organizational development and invest in the humans, but everyone wants their indicators met. It's almost like, who will meet those indicators if you don't want to invest in the humans? And in this case, it's the people who are most affected by this. So even just the structuring of health funding and financing is important for me, because often the money comes with conditions on what you can and cannot do. So even if you know there's a threat, even if you know that the organization and the people could benefit from some sustainable solutions around protection, you actually can't because, of those contracts. So I think it's very important to think about this more broadly. And just one thing that I have to say is that, people who live with HIV or any key population that has been determined to be at risk, they are more than just the HIV, They may also need support for cervical cancer screening. They may need support for harm reduction methods and support. They may need assistance with menstrual health and hygiene, and try to, in the content that we churn out, try to be more holistic so that we don't, again, fall in the trap of only looking at people through one lens, which is HIV. And think more broadly about what are the comprehensive needs of the people. Perhaps the project may only deal with one of those, but how do we assist the community able to advocate for themselves with or without us? And that way it means that we are aware of our own power and our own positionality as we come and enter into communities.
That's beautifully said. Thank you very much. And I think as you have highlighted, Dr. Saling, and as our colleague from Input highlighted, intersectionality is really the lens we have to take to the digital space, because we're really all experiencing very different worlds when we go online. My experience is very different from that of, for instance, a sex worker in Kenya, or, I think we've seen between and among key populations, very different experiences and realities and threats and opportunities, as well as different experiences for young women seeking sexual and reproductive health information or access to safe abortion. So I really am sorry that we're out of time. I feel like we could talk for much longer here, but we are just about done. So I really want to thank all of our panelists for this very rich discussion, and our audience for your questions and comments. We want to encourage everyone to continue the conversation on Twitter using the hashtag Digital Health Rights, and hope our panelists will continue to respond as well on Twitter. With that, I think there are some upcoming events to highlight for you. So please do join us for future discussions on global health and sexual and reproductive health. As you can see, we have 2 events coming up here, and you can sign up to get updates on our upcoming events. So thank you all very much, and stay safe and well. Goodbye.